The field of microbiology plays a crucial role in understanding the intricate world of microorganisms and their impact on human health. In this detailed script, we will delve deep into the fascinating realm of anaerobic bacterial infections. Anaerobes, often overlooked due to their preference for oxygen-deprived environments, have significant clinical implications and are involved in a wide range of infections. In recent years, there has been growing recognition of the relationship between alterations in the normal microbiome and the development of anaerobic bacterial infections. We will explore the impact of factors such as antibiotics, diet, and dysbiosis on the disruption of the microbiome. Additionally, we will discuss their role in promoting the growth and virulence of various anaerobic bacteria. Anaerobic lung infections, particularly aspiration pneumonia and lung abscesses, pose significant challenges in terms of their pathogenesis, clinical presentation, and management. We will delve into the mechanisms behind these infections, including the involvement of anaerobic bacteria and their potential complications. Moreover, we will explore the appropriate diagnostic strategies and treatment options for patients afflicted by these conditions. Intrauterine infections caused by anaerobic bacteria can have profound impacts on newborns, leading to the development of neonatal sepsis. This topic will analyze the common pathogens involved in such infections, the diagnostic challenges faced by healthcare professionals, and the potential consequences for the infected neonates. Anaerobic bacteria, with their ability to form biofilms, play an important role in device-associated infections. We will study their involvement in prosthetic joint infections, catheter-related bloodstream infections, and other similar scenarios. Further exploration will focus on the biofilm formation capabilities of anaerobic bacteria and the challenges they present in terms of diagnosis and treatment. Immunocompromised individuals, including those with HIV/AIDS or undergoing chemotherapy, face unique challenges when it comes to anaerobic bacterial infections. We will examine the specific considerations that should be taken into account, including appropriate treatment approaches and strategies to minimize the risk of complications. Polymicrobial anaerobic infections are complex, with multiple anaerobic species interacting within the infected host. This topic will provide an in-depth analysis of the identification and quantification methods used to detect the various anaerobic species involved. Additionally, we will discuss the implications of polymicrobial infections for treatment strategies. Chronic wounds, including diabetic foot ulcers, often harbor anaerobic bacteria, which contribute to delayed healing and increased morbidity. We will explore the role of anaerobic bacteria in the pathogenesis of chronic wounds, their impact on wound healing, and potential treatment strategies to counteract their detrimental effects. Anaerobic bacteria can cause surgical site infections, which can result in significant morbidity and mortality. This topic will analyze the incidence, risk factors, clinical manifestations, and appropriate surgical and antimicrobial interventions associated with anaerobic surgical site infections. While there is a wealth of knowledge surrounding common anaerobic bacteria, less common species can also cause bloodstream infections. This segment will explore the unique characteristics, clinical presentation, and antibiotic susceptibility patterns of these uncommon anaerobic bacteria, shedding light on the challenges they pose for diagnosis and management. Anaerobic bacteria, particularly those forming biofilms, have been implicated in the development and persistence of chronic sinusitis. We will investigate their contribution to the challenges in treating this condition and explore potential therapeutic strategies targeting anaerobic biofilms. Cystic fibrosis patients bear an increased susceptibility to anaerobic bacterial infections, particularly in the pulmonary system. This topic will focus on the manifestations of anaerobic infections in these individuals, including acute exacerbations, and discuss specific treatment considerations needed to optimize outcomes. The development of antibiotic-associated diarrhea, often caused by Clostridium difficile, is a well-known consequence of antibiotic therapy. We will examine the role of anaerobic bacteria, particularly C. difficile, in the pathogenesis of this condition. Additionally, we will explore diagnostic approaches and treatment options targeted at anaerobic antibiotic-associated diarrhea. In concluding this comprehensive script, we have extensively explored the intricate and multifaceted world of anaerobic bacterial infections. From the disruption of the microbiome to the manifestations in various anatomical sites and patient populations, anaerobes have proven to be formidable adversaries in the realm of infectious diseases. By gaining a deeper understanding of their pathogenesis, clinical presentation, and treatment approaches, future healthcare professionals will be better equipped to combat these infections and improve patient outcomes.